Hello, I'm Irma Baker. Welcome to our show. Today we're going to look at a topic that is probably, if you have not experienced it with anyone in your family or yourself, you're still curious about. And so I'd very much like to welcome our guest today. He is Chris Krepich, and Chris is the Community Services Program Manager for Life Bank. And Chris, I'm so glad you'd be with us today.
Thank you for having me.
And tell us, what is Life Bank? I'm sure people have seen the name in the news and that, but what is it? What does it do? And how did you ever get involved in it?
Sure. So Life Bank is the nonprofit organ, eye, and tissue recovery agency for Northeast Ohio. We're federally designated to be within the 20 counties of Northeast Ohio. We serve the 80 hospitals of Northeast Ohio. And what we're charged with is recovery of organ, eye, and tissue for transplantation, as well as educating the public for the need for organ, eye, and tissue donation and the importance of that within the transplant community.
Well, I had no idea you covered that wide an area. That is just a fantastic geographic area.
It is.
How in the world do you do it?
We have a staff of about 125 people who are not only on the clinical side doing the recoveries, but on the non-clinical side going out and educating the public about the need for organ, eye, and tissue donations. There's about 4.3 million people in our service area, so it's an uphill battle, but every day we're out there trying to get people registered as organ, eye, and tissue donors.
Well, I can personally attest to the need and the value of it, since my own brother was a transplant recipient, and we were blessed with having him for an additional 20 years because of the availability of transplants.
That's great.
So you're saying that it's organ, eye, and tissue.
Correct.
Oh, go a little deeper into that.
So the organs that can be donated are heart, lungs, kidney, pancreas, small intestine, as well as tissues ranging from long bones to skin, nerves in some cases, ligaments, tendons, and then on the cornea, on the eye side, it's obviously corneas that help individuals recover sight that they may have lost.
How do you actually recover the organs? You said the big part, I guess the first part is at the time of a transplant is actually recovering those organs. Sometimes I see those helicopters flying over. Is that something that you use?
So we don't necessarily use the helicopters. We're all ground transport. But our clinical staff, once we receive the phone call in our call center, all deaths within a healthcare facility within the state of Ohio have to be called into an organ procurement organization, which Life Bank is. And then we assess whether or not that individual is a candidate for organ recovery. And then our clinical staff is dispatched to that particular hospital to assess the situation and work with the transplant centers to coordinate the recovery of those organs.
Well, when you say that they all have to be reported, is that only if people have indicated they want to be a donor, or is it
That's
everyone?
all deaths, and then once the death has been signed off by the doctor, we then look to see if they are an organ donor, and then we move forward with recovery based on medical history and assessment of that particular situation.
How difficult is it to actually recover the organs and get that process moving?
So our clinical team, once they're dispatched, it could take anywhere from 36 to 48 hours once all the testing is done and the operating rooms are secured and the organs are recovered. We work very closely with the transplant centers and those surgeons to make sure that everything is recovered so that on the recipient end, that transplant can be more successful.
Now, with the recovery, you mentioned transplant centers. Is that a just a hospital, or what is a transplant center?
So there's 2 transplant centers in our service area, one at Cleveland Clinic and one at University Hospital Case Medical Center. And they're specifically dedicated to helping those individuals on the waiting list get that organ that they need.
So the transplant centers are where the the list is kept of people who want to or need transplants?
Not necessarily the list, but the patients are registered at those transplant centers. The waiting list is kept by an organization called United Network for Organ Sharing, and all of the patient information is housed with them, so that when an organ becomes available, all of that data is plugged into their database, and they then let us know which patients within our service area are waiting and would be the best match for those organs.
Certainly that's something that has to be done quickly in the case of the recovery of the organs and getting them to the right recipients.
Correct.
Well, while we're talking about databases and lists and all that, what is the urgency? What are the statistics for transplants in our areas? I'm assuming that we're very fortunate to have 2 transplant centers.
We are. So the current waiting list nationally is about 114,000 people are waiting. In the state of Ohio, it's just around 3,000 people. And in Northeast Ohio Life Bank service area, it's about 1,600 people are waiting for that life-saving transplant.
That sounds like an incredibly large number of people who need transplants.
It is.
What is your involvement? Now, you're the Community Services Program Manager, so are you on the education end?
I am. I'm on the community outreach side. Our team goes out and teaches people about the need for and importance of organ, eye, and tissue donation. We do that in a variety of ways, from high school programming to community events, lunch and learns, just anywhere that will allow us the opportunity to talk about organ, eye, and tissue donation and get more people to register their decision to be an organ, eye, and tissue donor.
What kind of questions do you get from people when you go out to these talks or presentations? What kind of questions are the ones that come up most frequently? And I would imagine that many people are afraid of the whole process or just maybe want to distance themselves a little bit.
I don't necessarily know if it's being afraid of the process or just not having all the information at the time that they want to make that decision. So that's our goal, is to go out and educate people. Most people make that decision at the BMV when you get your driver's license. That's when they ask if you want to be an organ donor. But we know that people are making that decision and thinking about it well before getting to the counter at the BMV. So that's why we're out in the community. That's why we're helping people to have all the information that they can, so that they're not afraid to make that decision, so that they can make an educated decision to hopefully save somebody's life one day.
Well, certainly, as I've said in my personal experience, it has saved lives. What's the most frequent question that you get from people?
Probably the biggest myth that people approach us about is asking if doctors or nurses will do everything they can to save one's life instead of allowing someone to pass away so that their organs can be recovered and transplanted. Doctors and nurses are sworn to do everything within their power to save someone's life, whether they're in an emergency room or an ICU. And then once all of those attempts have failed, that's the only time when organ, eye, and tissue donation becomes a topic of discussion.
And that's a hard time for families.
It is.
That certainly is. So the idea of having it on the driver's license certainly makes a lot of sense, because at least you have a starting point.
Correct. And it also helps the family members with one less decision that they have to make. If you make that decision early on, when you get your driver's license, maybe at 15 and a half or 16 years old, and it stays with you your entire life, that's one less decision that a loved one has to be burdened with at the time of an unfortunate passing.
What about eligibility? Are there certain requirements for a donor?
There's nothing that precludes someone from being an organ, eye, and tissue donor. The only thing right now is active cancer. If someone was to pass away with active cancer, that would preclude them from being an organ, eye, and tissue donor. Any other diseases or ailments that someone may have throughout their life may not necessarily negate the fact that they could be an organ, eye, and tissue donor. What we tell people is if you want to be registered, to go ahead and sign up on the Ohio Donor Registry and let the medical professionals kind of sort things out and determine whether or not organs, eye, and tissue of a particular person are viable for transplant.
So does that mean that there's no age limit on donation?
There is no age limit.
So anybody can?
Anybody can be a donor.
Ah, that really is remarkable, because, you know, you think that people, as we get older, that, oh, well, maybe it's our skin or our corneas or whatever aren't worth it anymore.
Correct.
So that's not the case.
That is not the case. I believe the oldest living at the time of death was 93. She was able to give her liver as a gift of life. And we had someone around the age of 100 within the United States who was able to give tissue.
So a 93-year-old woman was able to have a liver in such good condition that it was able to be used
Correct.
as a, oh my gosh, that is really phenomenal.
It is.
I would have thought, oh, well, the older you get, it's just not feasible.
Sure. No,
But
age is not does not preclude you from being an organ, eye, and tissue donor.
where do you see the most donors? And I don't mean in terms of accidents or that, but is it becoming more common for younger people as they are getting their driver's license or in their early adulthood to be perhaps more amenable to being an organ donor than maybe in the past?
We do see with our registration rates of those individuals who say yes to being an organ, eye, and tissue donor, as people get older, they tend to self-diagnose and think that they can't be an organ donor. So we see those numbers trail off a little bit as individuals get a little bit older. So that's, again, why we're out in the community educating people that age is not a factor, that if you want to be an organ donor, to go ahead and sign up and be one, and we'll take care of assessing whether or not organs, eyes, and tissues are viable. But the younger generation is saying yes. It fluctuates amongst different age groups. Again, that's why we're out there within the high school doing our programming there, so that those kids know when they go to the BMV they're going to get asked that question, and it's a good thing to do.
And that way they're going into it having some idea of what it is they're signing up for.
Correct.
So,
Correct.
how long have you been involved in this?
I've been with LifeBank in June, celebrated my 10-year anniversary.
Ah, that's a great, well, happy anniversary.
Thank you.
I'll tell you that. Why did you take a job with LifeBank?
At the time, I was finishing up my master's degree and looking for a career change from what I was doing, and have a little bit of a healthcare background. Saw LifeBank and the mission that they have, and chose to join the organization at that time.
Did this require a location change for you? I know you're here from the Wadsworth area. Have you always lived in Wadsworth or in the area?
I have always lived in the area. Our offices are based out of Cleveland, so it is a commute on some days. But the mission and what we do to just serve the people and giving individuals that second chance at life makes it worth it.
How did you find LifeBank? How did you find out that, oh, this is a place you might like to work and they actually had a job available?
Just general job search. The internet's a great thing for many different reasons, but was just able to find a job, and it seemed to suit my background and kind of what I wanted to do with helping people.
Well, I think that you enjoy going out and talking to people. Let's talk a little bit. For instance, we've mentioned the donors, and I think you brought along a picture of one of the donor families.
We do. We have a picture of individuals who lost their young daughter, and they made a decision to donate whatever could be recovered, and in this particular case it was tissue to help another infant have a second chance at life.
Oh, that's such a tragic situation, but so maybe heartwarming to know that a part of their young daughter was
Correct.
Going on.
Correct. We
with
hear
the
that a
life of
lot
another.
from the moms in these types of situations, that they didn't want another mom to feel bad or to go through the sorrow of their child being sick or possibly passing away. So this is a gift to pass on and help another mom have their child.
That is a wonderful gift to be able to
It is.
give. How, this may be out of the purview of LifeBank, but just your comments on it. Is it common now or not for recipients to know who the donor was or be in touch with the donor family?
At first, right after transplant, because of HIPAA regulations, we cannot divulge that information. What recipients can do, at least in our service area, is they can write a letter to their donor family, whether it's expressing gratitude or just their feelings about getting that second chance at life. We at LifeBank take that letter, we review it to make sure there's no identifiable information, and then we reach out to the donor family members to let them know that the recipient of their organ, eye, or tissue has corresponded with them. And if they'd like to receive that letter, we then pass it along. And it goes back and forth in that way until both parties get to a point where they may want to divulge identifiable information and exchange names or phone numbers or actually meet. Once that's done, we have a release form that they sign so that HIPAA regulations are still intact. And then if they choose to meet, whether it's over dinner or at, we've had individuals do it at some of our LifeBank events. It's then up to them, and we've heard some great stories of people just being integrated into each other's families because they're now connected because of that gift of life.
I think that's the process that my brother followed, that he sent a letter, and he corresponded with the mother of the donor who provided, in his case, a kidney and a pancreas, which was a significant transplant. But they corresponded for years. So, and it was a very fulfilling communication on both sides. Well, I think you brought along some pictures also of some of the recipients. We're not going to identify anybody.
Sure.
But let's take a look at some
Sure.
of them. Okay, we have a gentleman here, and there's another one. And, you know, they look very healthy. Obviously, these transplants have a good success rate.
Correct. Correct. We have individuals who have gone on to live incredible lives, 10, 20, even 30 years post-transplant.
That is something that I think 40, 50 years ago we would never have expected.
Correct.
When we've heard about those first heart transplants and they were the big news. But these people look like they're in good health and certainly living a life now that they would not have been able to live to this extent.
Exactly.
So, well, when you go out in the community, there are a number of things that you're doing out there. What kinds of events are out there?
So I spoke about our high school programming because those individuals, those kids are going to be getting their driver's license, their permits. They're going to get asked that question. It'll be their probably first time going into the BMV and experiencing that process, and helping them to understand that it's a good thing when they get asked that question. Our goal is to educate the children, the students, so that when they get to the counter, they may not necessarily be looking over their shoulder to mom and dad and having the mom and dad make the decision for them. Not only in the high schools, we're out at colleges doing what we call registration events, where we'll set up an information table, maybe in the student union, and get brochures and information in kids' hands so that they can register their decision to be an organ, eye, and tissue donor. And then on the community side, going to health fairs, community centers. We have lots of organizations within Northeast Ohio that invite us out to do in-services for their staff, lunch and learn, so that people can, again, learn more about organ, eye, and tissue donation, and then hopefully register that decision to be an organ, eye, and tissue donor after our presentation.
Well, we certainly have enough health fairs in this area. Well, we are a wonderful center for medical service in general, and I think you can find a health fair just about any weekend. You're going to find a health fair somewhere.
We are blessed for the health care that we have in Northeast Ohio.
So Is this something that you enjoy? Obviously, you enjoy going out and talking to the people. Is that something you ever pictured yourself doing?
I don't think so, but it is rewarding. Meet a lot of great people who have been touched by donation, touched by transplantation. The donor families who are just so happy to be able to help someone. The recipients who are obviously very grateful to have that second chance at life. It's just an incredible opportunity to be a part of kind of that gift of life, that second chance, and being able to communicate that and help others to make that decision. It's very rewarding.
Well, you've been here now 10 years with Life Bank. Have you seen changes over those 10 years?
There's been different ways of communicating our messaging with social media and technology. We're able to get more of our stories out there into the community, more pictures, more interviews, just share the incredible message more quickly. More people are accessing it. Not everyone waits for the 6 o'clock news, so we can get things out on Facebook or Twitter, using our website, lifebank.org, to share some incredible stories. That's probably some of the biggest changes that I've seen over the last 10 years, is just the able to disseminate a lot of information and get our mission, our brand, our message out to the masses a lot quicker. With those 4.3 million people, with our small department, it sometimes is an uphill battle, but with that technology, we can reach a lot more people than we were able to in the past.
Do you find that these make good feature stories and you're able to get your message out there? Do reporters come to you for this kind of information?
Absolutely. They're the heartwarming stories. There's so much going on in the news nowadays that can get us down or be negative. And these are the stories that really tug on the heartstrings and really show the humanity of people, and that there is good still in the world.
It's marvelous to have that available. And I had a chance to look at your Facebook page, and my gosh, you're really out there with the people all the time. But I saw something there, and I'm sorry, we do not have a green chair here. Oh. But would you tell us about the green chair? Sure.
So the green chair was a marketing kind of device that was developed back in 2010. A large kind of overstuffed green chair. And the marketing campaign behind that was we would take it to events. We would position it in places where people could sit in it. And when someone was sitting in it, it represented that somebody was doing something, was affected by organ, eye, and tissue donation, whether they signed up to be an organ donor and sat in the chair and got their picture taken, or they were a recipient and got to sit in the chair and just celebrate being together with loved ones. And on the flip side of that, when it was empty, it represented that something wasn't being done, whether somebody didn't want to register as an organ donor or somebody passed away waiting. So we were able to show kind of the positive and negative side of registering to be an organ, eye, and tissue donor. But that green chair was a great representation of that. Everyone has that comfortable chair in their living room. Everyone has that favorite chair that they sit in. So it was just a great opportunity to get our message and our mission out there to the public. Everyone seemed to relate to that chair. They would say that it reminded them of their grandfather's chair in his living room and how they got extra time with him because he received a transplant. It was just a great opportunity, again, to, in a unique way, share our mission with the people in Northeast Ohio.
That is really such a wonderful visual of what Life Bank is all about, of keeping those relatives, those friends, those people who are dear to us in our lives longer.
Correct.
So that they can sit in our living rooms. Even if we don't have a green chair, we might have a blue chair or a brown chair or something else, but it does keep us close.
Correct.
Keep us together.
And that's the exact message that we were trying to do with that.
Well, what do you see for the future? What do you see in terms of what is happening in the transplant area? And I know we're not going to get into the clinical end of it. That's for doctors and nurses and that to speak to that. But as you're looking ahead, what do you see for an organization like Life Bank and the entire need for transplants?
I think with the vision of our organization is to just do everything we can to save and heal as many lives as possible, whether that's through education and for us on the non-clinical side, on the community outreach side, using different data points to see where our programming is being successful or where we need to develop new programming so that we're reaching all those individuals in our service area. On the clinical side, so many of our staff are going through training and different in-services to be the best that they can be so that our organization, again, can save and heal as many lives as possible through organ, eye, and tissue donation.
It's such a gift. And you did bring along a brochure, and I'm going to ask you to tell us a little bit about that.
So when you sign up to be an organ, eye, and tissue donor, there's 3 ways to do that. One, as we talked about, is at the BMV. The other is you can go to our website, lifebank.org, click on Be a Donor, and you can sign up that way. Or there's through our registration brochure. This brochure is packed with a lot of information, myths, misconceptions, pictures about organ, eye, and tissue donation, individuals who have been touched by that, as well as a registration form. People can fill this out. They can mail it in to us, and we'll make sure that it gets attached to their driver's license or state ID so that the next time it has that little red heart in the corner when they leave the BMV.
I didn't realize that. I guess I thought that the BMV, Bureau of Motor Vehicles, is the only place where you could register. It's
the only place where the registration list is housed. It is attached to a driver's license or a state ID, so you have to have one of those to be registered. And most people do think that because that is where the question is asked. But there are those 3 other ways that you can register to become an organ, eye, and tissue donor, whether it's, again, through our website, the BMV, or through the paper form.
Well, I thank Life Bank through you, and I thank you for being our guest for this program.
Thank you for having us.
Yes, it's been wonderful, and I hope that there are many people who will be considering being an organ donor now. There are so many lives out there to be saved, as you said, so many just in our own area who could benefit from a transplant.
Absolutely.
So thank you so much, Chris, for being with us. And thank you all of you for joining us today. We hope you've enjoyed the show and found it interesting. Have a wonderful day. For us, for RSVP, I'm Irma Baker.